The problem we see every day with almost everyone is moles, what we call nevi in medicine. I know there are many special types, but today I chose the 10 most important and most common kinds that anyone might notice on their skin. What is the scientific definition of a nevus or mole? How do these spots appear and develop over time on the skin? Can one type of nevus really change and become another, or even turn into skin cancer in some cases? We will also talk about whether herbal and traditional remedies have any real role, and when they can be unsafe or misleading. Most importantly, are there proven, reliable medical treatments to deal with risky or annoying nevi, and when do we actually need to remove them or check them under the microscope? All this and more we will learn together in today's video. So stay with me. Peace be upon you. I am Hussein Lotfi, and you are watching the Optus Pharmacist channel with a new episode of Optus Pharmacist Derma. Welcome. Today's episode is about this important topic you see in the title. If you want to understand everything about nevi moles, stay with me from the first minute to the last. If you are interested in a specific type, you can choose a video that starts with the title you need. But as we always do, we will first take a general, simple overview of nevi. In medicine, a single mole is called a nevus, and the plural is nevi. The second point, what is the main reason behind the appearance of nevi? In simple words, it is a genetic change. This change happens in special skin cells that give the skin its color. These are called melanocytes. This is the most common and most important cause of pigmented nevi. But similar changes can also happen in other cells around the nevus, or in the fat cells in the skin, which leads to abnormal growth of these tissues. The degree and location of this growth give us different shapes and types of nevi. Nevi can be present from birth, appear in childhood, and stay with the person for many years. However, most common moles usually appear gradually and become more obvious before the age of about 30 years. Nevi are considered a type of benign skin lesion. In rare cases, some types can change into skin cancer, melanoma, and we will explain in detail how we distinguish between harmless moles and dangerous changes. What are the reasons that cause this genetic change and lead to the appearance of nevi? We have three main groups of causes. The first is hereditary. Congenital, some families are known to have a certain pattern or number of nevi that appear from birth or early childhood. The second is acquired. Something from outside affect the genes, such as strong or repeated exposure to sunlight, especially ultraviolet rays, or exposure to radiation. The third is spontaneous mutation. Changes in genes that occur without a clear trigger that we can identify. The next point, the number of nevi on the body, is something no one can fully control. In some people, it is limited, such as 10 or 12 moles. In others, it can be very high and may reach hundreds of nevi spread over the body. In summary, nevi are the result of a genetic change in certain tissues of the skin, most famously in melanocyte cells that produce the pigment that gives color to the skin. You may say, but I have seen a type that is very red in color, and people also call it nevus or a birthmark. In many Arab countries, this red lesion is also called a nevus, but medically there's a big difference. The typical brown or dark nevus is a pigmented lesion. In contrast, the bright red lesion that looks like a small red bump or patch is often hemangioma. Hemangioma is a benign growth that occurs in small blood vessels in the skin. On the skin surface, it appears as a raised or flat red spot, sometimes with a color similar to a rose or a bright strawberry. The difference between a pigmented nevus and a hemangioma is very important, because each one has a different cause, behavior, and way of management. That is why we call the nevus a pigmented lesion, while we call hemangioma a vascular or blood-filled lesion. In today's episode, we will continue to explain these points in detail, with pictures and examples, so you can easily recognize the common types, know when to be reassured, and when to seek a doctor's opinion. So stay with me. The second topic we have today, and maybe the most important one, is the well-known types of nevi moles seen around the world. Of course, There are many types, but today we will focus on the 10 most common and clinically important types of nevi. The first and most common type is the acquired melanocytic nevus. Acquired means a person is not born with it. It develops later in life after certain changes affect the genes inside melanocytes, the pigment-producing cells of the skin. This type is usually small, often less than 6 millimeters in diameter, with a very regular, even shape, clear borders, and a uniform color, usually light to dark brown, and sometimes slightly darker than the surrounding skin. The main factor that helps these nevi appear and makes them acquired is repeated, significant exposure to sunlight, especially ultraviolet UV rays. Over time, this UV exposure can alter certain genes and melanocytes in the sun-exposed area, leading these cells to multiply and cluster together, giving a darker spot on the skin that we recognize as a mole. An important point with acquired melanocytic nevi is that some of them can, in rare cases, transform into melanoma, a dangerous type of skin cancer. You, as a pharmacist or health professional, may not diagnose melanoma, but you can suspect when a nevus has started to change in a worrying way. For this, you should teach your patient the 5 key warning signs, known as the abcde criteria. Asymmetry. Look at the mole and imagine drawing a straight line through it in any direction. If the two halves do not look alike or do not mirror each other, this is a suspicious sign. B. Border. In melanoma, the borders tend to be irregular, jagged, blurred, or not smoothly rounded, instead of having a clear, sharp outline. C. Color. Normal moles usually have one uniform color. In melanoma, the lesion often shows 2 or more colors or shades, such as different browns, black, or even areas of red, white, or blue. D. Diameter. Many benign moles stay about the same size for years. A diameter larger than about 6 millimeters, roughly the size of a pencil eraser, especially if it is increasing quickly over days or weeks, raises concern. E. Evolving. Any mole that changes over time, in size, shape, color, thickness, or starts to itch, bleed, or form a scab without clear reason, should be checked by a dermatologist. If a mole shows 2 or more of these concerning ABCD features, it is very important to refer the person quickly to a skin specialist for full assessment. The second major type is congenital melanocytic nevi. Congenital means a child has this nevus from birth, or it appears very shortly after birth, due to a genetic change affecting melanocytes during fetal development. These nevi are often slightly raised above the surrounding skin and may have hair on their surface. What matters most with congenital nevi is their size, because size is related to the risk of complications. Small congenital nevi, less than 1.5 centimeters. Medium congenital nevi, between 1.5 and 20 centimeters. Large or giant congenital nevi, more than 20 centimeters, and sometimes covering a large body area. The larger the congenital nevus, the higher the lifetime risk of developing melanoma within that lesion. There is also another important possible complication in children with large or giant congenital nevi, which is involvement of the nervous system. In some cases, abnormal pigment-producing cells can also be present in the brain and spinal cord, a condition known as neurocutaneous melanosis. This can be associated with seizures or neurological problems. So children with very large congenital nevi often need follow-up not only by a dermatologist, but also by a neurologist or neurosurgeon. The third type is a dysplastic nevus, also known as an atypical nevus. This type looks different from common moles. It may be larger, with irregular borders and uneven color. Dysplastic nevi are important because they are more strongly associated with melanoma than ordinary nevi, especially in people who have many of them or a family history of melanoma. For this reason, dermatologists often examine these nevi very carefully and may take a biopsy, a small tissue sample, to rule out melanoma or to monitor any changes over time. The fourth type is a blue nevus. This nevus appears as a small, usually solitary spot with a blue or blue-black color. The color looks blue because the pigment is located deeper in the skin rather than at the surface. Blue nevi are typically less than 1 centimeter, and they can appear on the hands, feet, face, or other areas. Most blue nevi are benign, but if they change in size, shape, or color, they should also be evaluated. The fifth type is a Spitz nevus. Spitz nevi are usually dome-shaped, raised above the surface of the skin and smooth. Their color may be pink, reddish, or sometimes light brown. They often appear in children and young adults. Under the microscope, they arise from changes in certain skin cells and can sometimes resemble melanoma, so dermatologists may choose to remove them or monitor them closely, especially if they grow quickly. The sixth type is a nevus sebaceous, sometimes called sebaceous nevus. In this type, there is a genetic change affecting the sebaceous glands, oil glands, and nearby structures such as hair follicles. This leads to a localized overgrowth of these tissues, forming a thickened, often hairless patch or plaque on the skin. In childhood, its color may be similar to normal skin or slightly yellowish, with a smooth or velvety texture. Over time, especially after puberty, the surface may become more raised, rough, or warty, and the color can become more yellow-orange. Nevus sebaceous commonly appears on the scalp or face. Because certain benign and rarely malignant tumors can develop within nevus sebaceous in adulthood, dermatologists usually follow it closely and sometimes recommend removal. The seventh type is the halo nevus. This is a nevus similar to an acquired melanocytic nevus, but it is surrounded by a ring of lighter or completely depigmented skin, like a halo. This happens when the immune system attacks the pigment cells in and around the nevus, causing the surrounding skin to lose color. Halo nevi are often seen in children and adolescents and can be associated with other immune-related pigment conditions, such as vitiligo. In many cases, the halo nevus slowly fades and may disappear entirely without any treatment. The eighth type is Becker's nevus. Becker's nevus usually appears in adolescence or early adulthood, often in males, and typically affects one side of the upper body. For example, one side of the chest, shoulder, or upper back. It shows as a large, irregular patch of darker, hyperpigmented skin, and over time, this area often becomes more hairy than the surrounding skin. The lesion is usually confined to one side and does not cross the midline of the body. Becker's nevus is benign, but some people seek treatment for cosmetic reasons using laser or hair removal methods. The ninth type is nevus of Oda. This type is especially well known in East Asian populations and is more common in women. It appears as a grayish-brown or blue-gray patch of pigmentation on the face in the area supplied by the first and second branches of the trigeminal nerve, typically around the eye, temple, cheek, and sometimes on the sclera, the white part of the eye. When it involves the eye structures, regular follow-up with an eye specialist is recommended because of a small risk of glaucoma or, rarely, other complications. The 10th and last type is nevus comedonicus. The word comedonicus comes from comedo, the term used for the blocked pores seen in acne, blackheads, and whiteheads. In nevus comedonicus, there's a developmental change in the hair follicles and the openings of the oil glands in a localized area. This leads to many closely packed, enlarged follicular openings filled with keratin, skin protein, and sebum, giving the appearance of grouped blackheads or plugged pores arranged in a patch or linear pattern. The surface can look rough, with multiple dark or skin-colored plugs. Sometimes this area can become inflamed or infected, forming cysts or pustules. These are the 10 main types of nevi we will focus on today. Each has its own appearance, cause, and level of risk, which is why careful examination and, when needed, referral to a dermatologist are so important. In the rest of the video, we will link these types with real photos, simple explanations, and practical tips so you can recognize them in daily practice and know when to reassure the patient and when to insist they see a specialist. Stay with me. The third and second to last point with us today is this. If I, as a person, have one or more nevi, what should I do? And what do I really need to pay attention to? I need to focus on 5 main things. The first thing is medical history. This is very important. We apply the abcde criteria we mentioned before, and we regularly watch the nevus over time. We look for any change in size, color, shape, surface, or symptoms, such as itching or bleeding. We do this because if a change toward melanoma is going to happen, it can develop quickly, and early detection makes a big difference. The second thing is a proper, direct physical examination. A person may be living normally and suddenly notices a new nevus or an old one that has started to change. Should they ignore it? Absolutely not. They should see a doctor, preferably a dermatologist, as soon as possible so it can be examined carefully. The third thing is the possibility of further tests. If the doctor suspects a problem beyond a simple benign nevus, they may use a dermoscope to examine the lesion in detail. If the pattern still looks suspicious, the doctor will take a small sample of the lesion, a biopsy, and send it to the lab to study the cells under the microscope and reach an accurate diagnosis. The last important point is about children with large or special types of nevi, especially those that appear in the first weeks after birth. In these cases, it is not enough to see only a skin doctor. The child should also be followed by a brain and nerve specialist, neurologist, or neurosurgeon. The reason is to make sure there is no involvement of the brain or nervous system, and to check early for any possible neurological problems. As we explained before, the fourth and final topic with us today is, what are the treatment steps for nevi, moles, or birthmarks? First, there are a few very important points to understand. In most cases, for most common types of nevi, the main approach is no active treatment. This means there is no routine need for creams, no need for laser, and no need for surgery just because the nevus exists and looks stable. Many nevi are completely benign and only need observation and regular follow-up, especially if they are not changing and not causing any symptoms. There are, however, some specific types and special situations where removal or laser treatment may be considered, but these are the exception, not the rule, and the decision is always made by a specialist. Second, there is no such thing as proven popular or folk treatment for nevi. There is nothing scientific about tying a thread around a mole to strangle it, and nothing proven about putting turmeric, green tea, motor oil, vinegar, or any other random household substance on it. These methods can cause serious burns, infections, permanent scars, and color changes in the skin, while the original lesion may remain or become harder to evaluate afterward. So, please avoid these dangerous experiments completely. Third, one of the most important factors that can influence the appearance and number of some types of nevi is strong, repeated sun exposure. Ultraviolet radiation can damage DNA and skin cells and encourage new pigmented lesions or changes in existing ones. Therefore, if your work or daily routine involves being out in the sun for long periods, you must use a broad-spectrum sunscreen suitable for your skin type, reapply it regularly, and use protective clothing and shade whenever possible. At the same time, vitamin D remains important for general health, so its levels should be checked and corrected, if needed, by safe supplementation rather than by harmful, unprotected sun exposure. You might say, but I know people who had nevi removed with laser or other treatments, and they improved. Here, we need to pause at 3 key points. First, laser treatment is not suitable for every type of nevus. The decision to use laser or not is made by the dermatologist after examination and sometimes after a biopsy. The main role of laser in pigment lesions is to target and break down the pigment or destroy the cells that contain excess melanin in the treated area. However, laser does not prevent new nevi from forming elsewhere, and it does not replace proper evaluation for melanoma risk. It mainly improves the appearance of the existing lesion if it is judged safe to treat cosmetically. Second, there are some specific types of nevi where we may use topical medications for symptomatic or cosmetic purposes, not to cure the nevus itself. For example, in nevus comedonicus, which looks like clusters of blackheads or plug pores, we can use acne-type treatments such as adapalene or tretinoin at night to help open the blocked follicles and improve the surface appearance. These medications can reduce the plugs and smooth the skin, but they do not stop the underlying tendency for this type of lesion to exist. Their role is mainly to improve the look and texture, not prevent all future lesions. Third, some people confuse hemangioma, a benign blood vessel tumor, with pigmented nevi, and they read about treatments such as topical timolol, a beta blocker, and think it is a treatment for nevi in general. In reality, timolol is used in selected cases of superficial infantile hemangiomas to reduce blood flow in the abnormal vessels and help the lesion shrink or fade. This is not the same condition as a pigmented melanocytic nevus, and the treatment principles are different. So, Before mixing diseases and treatments, always check the correct diagnosis and ask a qualified doctor. Finally, never play with a nevus. Do not scratch it, cut it, burn it, or try to remove it at home. Any change or decision about treatment should be taken after proper medical evaluation. With this, we reach the end of our discussion about nevi. I hope I have given you clear, useful, and new information. If you like the content of this video and this channel, please do not forget to like the video, subscribe to the channel, and share it with others. And if you wish to support the content, your support on platforms like Patreon, PayPal, or YouTube membership makes a real difference. Have a great day. I am Hussein Lotfi.